Do you feel that your workers have anywhere near enough protection?
No, and I don't feel that the way the government have handled this has meant that we're operating the railway safely. You cannot have social distance of 2 metres and have the crowded trains, buses and tubes that we've got at this moment in time. And that's down to clear lack of direction from the government what should be doing.
Well, we're told the public need to display common sense. But the reality is the public have just seen the stay-at-home message get abandoned, and they're now, from these pictures we're looking at, coming off a bus, behaving exactly as they normally would when they get on board and disembark from a bus. And that is going to cause, I assume, a rise in infection.
Yeah, I mean, there'll be a conduit. We'll see an increase in infections if the government don't get their act together and give clear direction about how the trains, buses and tubes to operate. It's quite clear to us that it's unsafe to operate a service if you can't keep 2 metre distancing. And we'll be saying that quite categorically. And that's why we said to our members, if it's unsafe, don't do it. We've already had problems dealing with the announcements that the Prime Minister made on Sunday, where we've seen a surge in use of trains in particular and tubes. And you can see from the pictures that people are not exercising social distance. It's amazing. The government turn around and say to people, either stay at home, but if you go home, say to a park, keep 2 metres distance. But if you go on a train, don't worry.
It's ridiculous.
Well, and Widdecombe, the government said, try and avoid using public transport. But of course, millions of people cannot get to work any other way than using public transport. And it's impossible to use your common sense as an individual to try and keep 2 metres away from another passenger if the tube carriage is packed. What should be done in order to help commuters when the government says go back to work?
First of all, we've all seen the pictures before the lockdown was eased of key workers also having to travel in packed tube trains. We've seen those pictures. We know it's been going on for a long time. It's nothing that is suddenly new. But indeed, common sense could consist of lots of things. Keeping your head away from the person next to you, wearing a mask, whatever it might be, or it might mean just deciding that because 9 out of 10 deaths have been with underlying health conditions, 4 out of 5 people hardly even know that they've got it when they've got the disease. People may be just deciding that they're going to take that risk. Now, it is down to the individual, but it is crucial that those who are healthy get the economy moving again.
But when you say, Anne Widdecombe, it's down to the individual, why should it be down to an individual to go onto public transport, ignore social distancing, potentially get the virus and then transmit it to other people who have made no choice in that decision whatsoever?
Well, first of all, of course, you don't make a choice about observing social distancing if that choice is there. The problem with packed tube trains is that you just can't keep the 2 metres apart.
But that's my point.
So
if you leave it to common sense,
making a choice.
An individual choice.
That's my point, Anne. If you leave it to common sense, as we're seeing, people just forget. You've got to be, in my opinion, if you're going to make people be 2 metres apart, you've got to enforce it. You've got to have people on the train system, on the bus system, enforcing 2 metres. Otherwise, as we can see, people ignore it.
You won't be able to enforce, I was trying to say, that you won't be able to enforce 2 metres on public transport, which is very heavily used. If we don't get the economy going, there are going to be huge long-term health problems as well as economic problems. It's got to be kept moving, and it's got to be kept moving by the healthy. Now, just look at the statistics. There's hardly been any deaths. There have been some, but there's been a very tiny percentage of death amongst the healthy under 40s.
And how many of the elderly...
They should be getting the economy
How many of
going.
the elderly, were infected by young, healthy people who had the virus?
Well, that is something that we will have to find out in due course, but the elderly are now shielding. So that question doesn't come up.
But the elderly have now been told...
They don't have to...
The elderly have now been told they can go back out again. Again, the government's message is, come on, let's all get moving. Let's bring in Sir Dave King. Dave King, my gut feeling is to be overly cautious here. simply because I remember, having read it all, what happened in 1918 with the last pandemic, when everyone rushed to go out too early, and the second wave was overwhelming, which, if it happens again here, will be far more devastating to the economy than anything we're seeing now.
Piers, your point is exactly correct. If we want to get the economy moving quickly, and we all want to see that, if we want to minimize the number of deaths in the community at large, those two fit the same parameters. Do not emerge into the full working space until we have everything under control. And at the moment, the test trace capability of the country is simply not up to it. If we look at the countries that are getting out of this quickly and well, like South Korea, like Hong Kong, and like Greece in the European Union, they have got their testing, tracing every contact, isolating every contact in place before they started opening up to their economy on the May the 4th.
Sir David King, what I didn't understand was that the government made testing one of its tests before it said it was going to be OK to ease the lockdown, but then has not reached the 100,000 daily tests a day and has still eased lockdown. I'm also confused that the government keeps saying social distancing is the most effective way to prevent the transmission of virus, but then sends millions of people back to work on public transport where we all know you cannot abide by social distancing. I don't understand what the science is that the government is using which enables it to ease the lockdown without retransmitting the virus in society.
Well, you're quite right. This cannot be based on scientific advice. What I see is a dangerously incoherent policy, just as you've described. If we're told keep that 2 meters distance apart, go out, meet only one parent or child at a time from elsewhere, but always 2 meters apart, and then telling people in London and other cities, get on the public transport, get to work, is completely incoherent.
Yeah.
And let me say, if we're going to open up public transport and say, please use it, we have to set the 2 meters distance as a requirement. We have to make sure that everyone is required to wear a mask.
Which they are doing, by the way, in some other countries. And Widdecombe, do you think that the government's new announcements make sense? Do you understand them?
I understand them, yes, because I think the essence of it is stay alert as opposed to stay at home and minimise the risk so that when you're out and about and you really have a choice in the matter, you should and you must maintain social distance, and that to me is common sense.
Okay, well, let me ask you a couple of things. How can it be, for example, how can it be...
Hang on, and it's been... No, Piers, stop interrupting when I'm trying to make a point, please.
I'm not talking.
Okay. What are you doing?
I'm talking now. I wasn't when you were shouting at me.
What I was saying was that where you have no choice, then you've just got to use as many precautions as you can in that situation. We've expected that of key workers throughout this whole lockdown. We've expected it of key workers. Now the rest of us have got a role to play.
Mick Cash, for the General Secretary of the RMT Transport Union, I wonder whether more could be done to enforce social distancing, whether there should be just masses of staff stopping people getting on buses, limiting the number of people on tubes and trains, whether face coverings should be made mandatory on all public transport. At the moment, it's simply suggested. I mean, I just can't see how you can get on a tube at the moment and be safe.
You can't, and you can't get on a bus in the same way. You can't get on a train in the same way, and it's categorically clear about that. We all know that. I'm just amazed by Anne Widdecombe saying that, by the way. She's saying, it says a choice. There's a lot of people in the poor parts of our society who have got no choice. And it's all right for the rich to stay at home and not travel, but the workers and the poor people in this country do have to travel. And I think it's bang out of order to say you've got a choice. People have got no choices. What we've got to do is protect those people when they're on the network, the bus and tube network and the rail network. And the reality is this: we had a plan we laid out, particularly with the rail industry, about a phased incremental increase, which would have covered all the points you've just made. And yet the government rushed ahead completely in a chaotic and in a chaotic way, and allowed usage of the rail network, the bus network, without those plans being put into place.
Yeah, it's completely.
They are putting our passengers and our members at risk, and it's not on.